we talk about the endocrine system. We're talking about hormones that have an effect on target tissue. We're dealing with the autonomic nervous system many times, although it can be parasympathetic too. Autonomic nervous system, hypothalamus is one of the main, and then pituitary gland is another gland in the brain that has a component that really does affect. And with anterior, posterior pituitary, that lets off, pre-hormones that will trigger the actual hormones to be released from certain glands. Does that make sense? Like, so you have things like, for example, you have luteinizing hormone that's let out by the anterior pituitary gland. That will actually stimulate other hormones, the sexual hormones, other hormones to be released from either the ovaries, the testes, follicle stimulating hormone, FSH, will stimulate like estrogen to be produced. So these are like the pre-hormones to the actual hormones that are going to be released from the organs. Serum hormone levels are usually what tells us if there's a decrease or an increase in levels. And things like CT scans, MRIs, and radiographies help to tell if there's tumors. And other things like the Tanner scale help to tell with sexual development, and heights and weights help to tell if there's a problem with growth. And again, these are some pictures of all the different glands that that are affected in the endocrine system. So developmental issues. Usually at birth, the endocrine system is more underdeveloped than any other system, meaning that there's not the real level of hormones that are being released. A lot of it does come from the mother. Hormonal control is really lacking until the first year of life. Puberty usually occurs when the sexual hormones are increased. Pituitary dysfunction is usually seen with growth hormone deficiencies. And endocrine problems of childhood are mostly hypofunctioning issues, not so much hyper. Okay, so hypopituitarism is usually seen as a decrease in growth, but it's when there's lacking more than one hormone that's produced by the pituitary gland. And again, it's classically seen as a growth hormone deficiency, which basically means it's a condition in which there's inadequate release of growth hormone, and therefore the person has a shorter stature. It is a rarer condition, 1 in 3,500 children. And in the classic form, it's a failure to sustain the normal growth of height of other children their age. So they stay in this percentile until they reach usually like school age, and then they start to drop off in their height percentile. So like, for example, somebody's in the like 50th percentile the whole time. Then they get to be 7, 8, 9. Now they're with other children, they're dropping off. They're in the 20th percentile, 10th percentile, less than 5th percentile. Very quickly they drop off instead of maintaining that 50th percentile, which is what they should. Now that being said, you want to know if it's a true growth hormone deficiency or if it's a genetic, maybe, and again, that's why you look at percentiles. Somebody who's below the 5th percentile for their height, consistently, genetically may just always be a lower height, okay? For example, if you have a father who's 5 foot and a mother who's 4'8", you're not going to get a child who's in the 50th or 75th percentile for height. You're just not, because genetically they're not going to be there. So you wouldn't consider that a growth hormone deficiency. Obviously, the way you test for growth hormone deficiency, which we'll talk about in a moment, would truly tell you if they have a deficiency or not. With growth hormone deficiencies, what also can be seen is a hypoglycemia, because growth hormone keeps insulin in check. It balances insulin, so that's one of the jobs of growth hormone, especially in this age group. So children that have a true growth hormone deficiency also can have a hypoglycemia, which can get very low. So it's something you want to watch. So obviously you'd be taking blood sugars, tracking those things. And what is growth hormone? Obviously, it's what increases the height of the person, growth in the long bones, and their stature growth is slower than normal velocity. They can have the hypoglycemia, as I mentioned. They appear younger. It can even delay puberty. Why? Anybody know? Growth hormone actually stimulates the sexual hormones. That helps so that's where you can see that. And their born age will be years behind the chronological age. So, a stature below the 5th percentile. The other thing they do is, what they do is in the evening time, they'll give the person an injection of somatotropin C. Somatotropin C is actually released by the hypothalamus. Okay, somatotropin C stimulates stimulates growth hormone. So what they'll do is they'll give an injection of somatotropin C, and then they'll wait a few hours and they'll draw the blood to see what the levels of the growth hormone are. And if there are normal levels of growth hormone, that means we have a problem with what? With the hypothalamus. It's not a growth hormone issue. Where's growth hormone released from? Growth hormone itself. It's a gland. No, not thyroid. There's only so many, right? That's right. Yes, the anterior pituitary. Did somebody say anterior? Oh, okay. There you. So, but the hypothalamus starts. Let's go back with. Let's go review hormones for a minute. The hypothalamus sometimes triggers the pituitary. Then the pituitary either releases a hormone or triggers another gland to release a hormone. So, for example, follicle-stimulating hormone would be released, and then it would stimulate estrogen in the ovaries, or testosterone in the testes. You know what I'm saying? So in this case, you have the hypothalamus releasing somatotropin C. That stimulates the anterior pituitary to release growth hormone. And then growth hormone will increase the signal. So if I give an injection of somatotropin C to somebody, and their growth hormone level stays low, then I know I have a problem with the pituitary gland, right? Because it's not. But if I give an injection of somatotropin C, and the growth hormone level goes to its normal, where it should be, now I have a problem with the hypothalamus not releasing somatotropin C. And somebody might say to me, well, why didn't I just check for somatotropin C in the blood? Well, we haven't developed that yet. But we're getting there. So if it were that easy, then we could check for that. Okay, so we're actually stimulating to see if it's an issue with the pituitary gland or the hypothalamus. That's what we're trying to determine. Does that make sense? So if I have a true problem with releasing growth hormone from the pituitary gland, and I can't release growth hormone, what do you do to correct that? Give injections of growth hormone, if it's a growth hormone problem. You can give somatotropin C if it's that. So yes, growth hormone replacement therapy. And therapy is considered successful if there's an increase 2 centimeters a year, not big, okay? But again, it's more about that there is some growth. So, okay, you have a parent come up to you and they say, my son is short. My husband and I are both short. Can you give us some growth hormone? He's really giving us a hard time. And he's so much shorter than everybody else in the class. This happens. I know you're gonna, but it does happen. Isn't there? And there are doctors who prescribe, there's a whole black market for growth hormone. You know, talk to these sports players, right?
Sylvester Stallone.
What?
Sylvester Stallone.
Yeah,
He was a big proponent of it. He didn't even hide the fact. He thinks
Yes.
it should be like
Yes.
a legal thing.
Exactly. So why can't I give that to my son?
Has some side effects.
That's
Possible
right.
side effects.
Yes, that's right. It's
Yeah,
had a lot of side
acromegaly.
effects, actually. That's right. Acromegaly, transverse growth of bones, tumors, testicular cancer, brain tumors, bone tumors, all increase with these medications. Seizures, neurological irritability, what they call. So again, this is not something you want to be using unless you truly have it. Now, people who truly have a growth hormone deficiency, it will not cause these problems. It's when you have an excess of growth hormone, because they already have a normal level, and now they're increasing their level. That's when they have the risk for all these side effects.
So why are they, like, Sylvester Stallone took it as an adult? Like, why would you take it as an adult? What is it doing?
Well,
Steroids?
look at him now compared to look at him when he was 30 years ago. He's significantly larger. And
Yeah.
there's a lot of articles now that say it's harder to be a
Most-
male Hollywood star than it is to be a female, because for males they expect you to be basically a god of muscle. And it's like, it's almost an unrealistic expectation of what people are. Same thing with sports players.
Actually, yeah, and that's, growth hormone is what they were abusing. So most steroids are mostly growth hormone, actually. And they're
So
saying,
it works
yeah.
like muscle and everything too, not just height.
Yes, that's exactly what it does. It increases the muscle, if you already have a normal level. So for example, if you have a decreased growth hormone in your blood system circulating, you're not gonna grow these big muscles. you're just going to have, you're just going to be, but if you have an excess, that's all the things that can occur because of it. So again, that's what this case study talks about. Hyperpituitarism, very rare in children. That's where you see that acromegaly. Can be seen in adolescents. It's when you see this really, really tall. Sometimes there's basketball players. You see something?
So just jumping back to the growth hormone
Yes.
thing, and not just for like people that are looking to get very large and stuff like that. I think they can prescribe it for older adults that find themselves with a little less energy and find themselves tiring out quickly, more quickly than they used to now. I think they prescribe it in like low doses and stuff like that.
Yeah, because they've actually found that as your growth hormone decreases over time, you can have sluggishness, that's controversial too though. But again, very low doses they find is what they're using it for. Acromegaly, so enlargement, frontal bossing, large jawline. These people can also have tumors. There was a whole documentary about a man from Russia who was in a circus making a lot of money, and he literally had a pituitary gland tumor, which is usually what causes this most of the time. So he had excessive, from when he was 14 up, he was like 8 feet tall. He had frontal bossing. He had a brain tumor. Eventually, that was enlarging, and he refused to have the surgery. Eventually died of seizures, brain trauma and seizures, and died because, and from the tumor, because he did not want to have it because he was making all this money being in these shows, unfortunately. So again, more rare, but obviously can be seen. And the way to take care of this is usually it's a pituitary tumor, so they can do transsphenoidal surgery fairly easily, which is through the nose, and they actually can remove tumors that way. And then you can usually have a hypo issue. And